So today, so today we're going to be talking about social psychology and social psychology, especially in the therapeutic practice. Okay. Before that, I'm going to introduce myself. My name is Arpita S. I am a psychotherapist and I'm an expressive art therapist from UNESCO CID France. I'm also the founder of AS Psychotherapy, and today I'm going to be conducting this session for you. So the session is going to be divided into two parts. The first part is going to be me explaining certain concepts of social psychology because there's a possibility a lot of you are students from bachelor's, a lot of you might be students from master's level, psychology or otherwise. So I just want to give you a brief idea of what social psychology is. Yeah. So we'll start with the definition. If we could move the slide, please. First slide. So, anybody here, would you like to tell me about what is social psychology? What is the definition? Yes, Madhura?
Social psychology actually refers to the term how people behave, think, and express themselves in social context or social settings. There are various factors like how socio-economic or social support can enhance individuals' support system or confidence. Also, self-perception and various factors are there. And I would like to say that man is a social animal, so psychology plays an important role.
Absolutely. That is absolutely correct, and that's a very good way to introduce. So, yes, the very first thing that is very important to understand that man is a social animal, which means ever since we were children, we needed society. Yeah. So society initially for us were our parents, primarily our mother or a caregiver, and then it expanded to others. So if we were to formally look at a definition of social psychology, it was Gordon Allport who defined social psychology as a scientific study. Okay, and scientific study of what? Of how individuals thought, felt, and their behavior. How is it basically influenced by the actual presence, the imagined presence, and the implied presence of other human beings. Yeah. So, what is an actual presence here? The actual presence is in person presence of caregivers, parents, friends, society. Imagined presence can be something like social media because we interact with social media. We interact with celebrities, influencers, but however, they are imagined because we are not in direct contact with them. And sometimes it is also implied. Okay, like society. What is society? So that's a huge concept, right? So that of other human beings. Yeah, and especially social psychology is about understanding how every individual's behavior is influenced by social environment. Okay, so the behavioral part is very, very important here because it is that which defines things. All right, now we're going to be looking into some aspects. So, the very first one for that is social perception. Yeah, what is a social perception? Social perception is how individuals perceive themselves. Okay. How do they perceive themselves and others? But a lot of this is influenced by social factors. So the way I look, okay, I might look in the mirror and be like, I'm looking really nice. But the moment I step out of my room, maybe it will be my parents looking at me. Maybe it will be my extended family looking at me. Yeah. And that will also define how I feel I'm looking. Okay, so social perception also will include attributions of how individuals explain the causes of behavior and impressions formulated when other people's judgments are into consideration. Okay, no matter how much limited it is. So when I'm stepping out of the room thinking like I'm looking really good, But the moment somebody makes a remark, that is a social impression, right, can be wrong. So as therapists, we take a look at that perception as well. Okay. We're going to be going to the next slide, which is about interpersonal relationships. Yeah. What are interpersonal relationships in the context of social psychology? So, social psychology will examine the dynamic of interpersonal relationships. And what are these dynamics in interpersonal relationships? It can be attraction. Yeah. It is normally said that, okay, you look at somebody at the social media, you find them attractive. Somebody goes for a job, a person finds them more attractive, and they end up taking up the job. Sometimes that happens. So attraction then determined how the interviewer accepted candidate. So that happens. When we choose our partners, when we look at somebody and be like, oh, I like this person, a lot of times it is dependent on that attraction, that initial attraction. Possibly it can be physical, possibly it can be intellectual as well, but there is this attraction factor that is very important. Yeah. Other times it is also intimacy. In a small environment, when we are interacting, do I feel close to you? Do I feel I can connect with you? Do I feel I can talk to you? That is also a very important factor in interpersonal relationships, which is why in a huge group, we are able to make friends with certain people and we are not able to make friends with others. Okay? Same when it comes to society. In our society as well, the premises that we live in, certain neighbors we get used to very quickly. We like them very quickly. Others take time. So there as well, that intimacy factor is there, that common denominator. Yeah. And the next is communication. How you communicate and how the other person communicates. How you communicate and the group communicates. Yeah. Because there is a possibility even in group, you have subgroups. How are these subgroups created? What influences these subgroups to be created? All of that is included in social psychology. And in therapy, that is also something that we pay very, very close attention. If we are going out in a group and we are finding one friend and there's a whole group, why do you feel you related more to this individual? If a person is going in a group and he's not feeling comfortable, what is it about the group that you're not feeling comfortable with? Because that can happen, no? As we get into the case study today, this factor will come in very, very useful. Yeah, because some clients will struggle to make relationships. Some clients will blend in beautifully. A lot of that is important when you're sitting in the chair of the therapist. So for you, if you have a client who's telling you, I'm not comfortable, ma'am, I don't feel like talking to them. I don't feel like I'm accepted by them. There is something that is playing out on their mind. And that is something that we look into when we look at interpersonal relationships in social psychology. It all comes down to man is a social animal. But is he well adjusted so to some people or is he not? That is also something that we look into. And these days, in the world that we live in, interpersonal relationships ke baad, you have social influence. Yeah, that is the slide we go to. So, what is social influence today? I would like to take your opinion. So, if there's anybody who would like to talk about it or share an opinion, anybody can raise their hand. What influences you socially as a person? Forget about the therapeutic setting.
Good
No
evening,
one?
everyone. Good
Yeah.
evening,
Hi,
Arpita.
Swati. Yes, good evening.
Hi, good evening. So socially, what makes you speak to a person or to match the vibes? That is like very
Yes.
trending on
Yeah.
the same vibe. So
Yeah.
it's first what I believe is the appearance.
Yes.
Actually, now again, there is a uh, if we see from a point of psychology, or if you are a very like a person, like who's very much into self care, and you look for certain attributes, the
Yes,
certain qualities in a person. So if my perception is that a person should be well dressed and well behaved,
yes,
and intellectual level has to be good while
yes.
opening his or her mouth, like initiating a conversation or a communication,
Absolutely. Mhm.
and it should match my wavelength, you know
Okay.
wavelength. When I say, it's like when I'm in an event where the influence are there, like I've been to one of the event over here in Bahrain, that is a launch of a national team's cricket team's t-shirt jersey. So
Yes,
if I'm not aware of the content, like what is about cricket and what is about sports, so obviously that whole event will be useless for me, being
yeah,
spending 2 hours over there. So I need to have that connectivity with the people, the topic, what I can exchange my point of views with them. So
yeah,
these are the attributes. It might depend from people to people, like what exactly you look for and what exactly I'm looking for. So these are
yeah,
the social connects what we try to find out when we are in a bigger group, in a larger group.
yes,
Since we are talking about social, so it is a group of more than 5 people or 6 people. I would like to summarize like that. So it's basically your perception and the attributes what you believe in, which help you to connect with other people.
yeah. Absolutely. Yes, that is there. Anybody else? All right, yes, so Swati is absolutely right. So again, it depends from individual to individual. Hence, it is very important that in social psychology, if you have had one client who had some issues relating to how to be a part of groups, or how to be a part of a family, or how to be a part of an extended community, don't ever look at two patients in a similar way. Yeah. So while taking your clients, while getting into therapy with clients, please make sure whenever you're getting in with a new client, you wear a fresh lens. Yeah. Because there's a possibility you have an entirely new person. And that is also very, very important. So what is important for one person in a social setup might not always be important for the other. And each different. That is what makes us unique as human beings. Yeah. So when we are talking about social influence, we are also talking about the fact that individuals are influenced by others in the environment. Okay. So if you're going to a gathering, for example, you're going to something that is a social cause, you have a particular opinion, but you're listening to somebody else. And you feel like, wow, this is something that I really like. This is an area that I really want to look into. There will be a part of you that is influenced. So, what got influenced? Was it the speech? Was it the content? Or was it the appearance of the person? Because there's an underlying thought process that everybody gets influenced by their environment. Okay, when you're going through your social media as well, and these days, the biggest place of social influence is the social media. Your Instagram, your Facebook, your Netflix, your YouTube, we're getting influenced every day. And social influence goes to a very deep level in our lives. It dictates the way we dress. It dictates the way we choose certain things. It also dictates the way we use certain products. What is in, what is out. And who is deciding it? It is people at large. So it is a group of people or sometimes that one influencer. And hence it is different for every individual. Yeah. And again, the underlying belief is that everybody is influenced by the environment, and this can be coming from something like a group. You join a new group of people, you move to a new college, new rules, new environment, new culture. There is going to be something in you that is going to be influenced. Okay. Authority figures. You have your professors, you have your teachers, you have somebody, an older cousin, influencer. You're going to be influenced by that person. Yeah. So that is also going to be contributing to who you become as a person. Yeah. And social felicitation. a lot of times we try to be accepted in society. Yeah. For example, you choose to wear clothes from particular brand. You choose to have a gadget from particular brand. Not because always you like it, but sometimes it is socially cool. Yeah. And this generation in particular is very much into I need to fit in or I may not fit in. And if I don't fit in, oh my God, it's a big deal. So why is it a big deal? Why is it important to fit in? Are you trying to fit in? And why are you not fitting in? All of these questions are going to be a part of your therapy process whenever you have a client who's coming with any social issues. Yeah, very, very important. And in therapy, you always need to take a look at what are his expectations. The society he's around, the peer group that he's around, the older generation that he's around, what are they into? What is acceptable? What is not acceptable? Because there's a possibility he is going to be impacted and he is impacted already. That is what we look into. And those are all the things that we take into consideration when we look at social influence. Okay? All right. And the biggest reason that why are we looking at social psychology? Why are we looking at social influence? We move to the next slide of conformity. Yeah. In conformity, we are all trying to play by the rules. Whose rules? The rules of the society, sometimes the rules of the peer group, sometimes the rules of influencers on Instagram, other social media, or sometimes by older cousins or your boyfriend, your girlfriend, whichever way, husband, wife. We're trying to fit in. We're trying to somewhere be a part of a group. We're somewhere trying to be the cool crowd or the crowd that is accepted. Because there might be a belief, not in every person, of course, that if I don't do this, if I do not conform, there is a possibility I might not be accepted. And what does a person do to conform? Yeah. So to confirm, what happens is that an individual adjusts themselves. We adjust ourselves to fit into any new group, any new society. So we are adjusting our attitudes. Sometimes we adjust our belief. We also sometimes match our behavior to match those around us so that the majority of the group agrees with us. Yeah. So this happens when we are trying to fit in. So also here comes the concept of shame and grief. Okay, very, very important these concepts are. Because we feel like if we don't fit in, we are not accepted, I might feel ashamed of myself. I am the only one not wearing branded clothes. Everybody is doing that. I feel like I won't fit in. I need to conform. So even if my budget doesn't allow me, my social circumstances are not like that, my family circumstances are not like that, I'll still try to push my budget and get something like that. My beliefs are not matching with these people, but I've moved to this place. Now I have to do it. So these also might be issues that might come to you when you are taking clients in therapy. Yeah, Palak? Palak, you've raised your
As you
hand?
were hello,
Yeah.
yes, can
Yeah,
you
go
hear
on.
me?
Yes, I
Okay.
can.
So as you were talking about conformity, I just realized that my parents have beliefs that we should sleep early and the sleep
Yeah,
schedule. But when we moved into the
yeah,
new society for like more than nine
yeah,
years, now during
yeah,
Navratri and Ganesh Chaturthi, they tend to go out till
yeah,
3 to 4 with the group of people in our society.
yeah,
So
yeah.
because of that, the behavior
Yeah,
has changed. Yeah.
that's such an excellent example. So, is this a new society you said you moved into?
Yes.
Okay. And what used to happen in the previous society?
Previously, they used to tell us, me and my brother, that we should sleep early and everything. But now
Yeah,
they are the ones going in the group okay, let's go
Yeah,
out
yeah,
and all. Yeah,
yeah,
they were
yeah,
really against it, but now it has
yeah.
transformed into this. Yes.
Okay, yeah, that's an excellent example trying to confirm why. Because this is a new society, this is a new culture, these are new people, these are new neighbors. We want to fit in because we are new here, we want to make friends. So we are going to slightly change our beliefs to sort of match that of the people in the society.
Yes,
Would
exactly.
that be right, Palak?
Yes, yes.
Okay, thank you for sharing that. Yeah. Of course, with in the case of Palak's parents, it can be quite free. Like they want to do it, they do it. But sometimes there is a possibility if a person disagrees, okay, their beliefs are completely against it, but there is also a possibility that I might be shunned from that close group. Yeah. If I'm getting into a new job, all the employees there take 1 hour break during lunch and they go to a local cafe and they eat. But I don't have that habit. I sit at my desk and I eat. But the fact is, I'm moving there, I'm not joining them. They feel like, oh, this person has a lot of attitude, she doesn't want to mix with us. And then it will be like the boss asking me, like, oh, why are you not joining the entire crew for lunch? Then I have to, even though I don't want to. Otherwise, I'll be socially isolated. So, there, privately, though I disagree, or any person in this position disagrees, they have to do it because a group of people are doing it. And that is what we call conformity. Okay, this is what we are talking about. Now, there are certain factors also that influence the conformity. The next slide, please. Yeah, the first one is the group size. How big is the group? Okay, if it is 2, 3 people, it's like, oh, it's still okay. होगा नहीं होगा चलेगा, no problem. और बड़ा group हो गया है, then it will be like कि, oh, this is a bigger group. Then more people are involved, more opinions are involved. And then the question arises. So again, the group size is also important because as the size gets bigger, there is going to be a majority opinion. And if you don't agree with the majority, then you are sort of an outcast. Not in all cases, but sometimes. If you're okay to being the different person, it works out. But if you're not, and if things get a little out of hand, then sometimes people become socially isolated and also then come for therapy. So these things also are something that you need to keep into consideration. All right. The next thing is unanimity. Okay, this is like the spelling mistake. So if in a group, see normally what happens is there is an agreement. When there is an agreement, there is like people coming together, and once people come together, okay, we all are in this together. Yeah, so when it comes to unanimity, is also like we belong together kind of a feeling. And that is important somewhere for the cohesiveness of the group. Yeah, which is again the next point. Yeah, that is also very, very important. Because somewhere that group cohesion is important. Otherwise, if there are people disagreeing, there is a possibility that the group might not be together for a very long time. Yeah. So there, okay. So there are two concepts here. One is group cohesion. Okay. See, when it comes to the group, ideally, when we are making a decision, like we have this, we have school. स्कूल को इन दिनों में बंद रखना है कि नहीं बंद रखना है. If everybody is in agreement, there is a possibility that the school will be closed. But if there are people who don't agree, then again there is no cohesiveness in the group, and then decisions change. And hence there are two concepts that influence conformity. Okay, do you agree? Because conformity is very, very important for the strength of the group and for somewhere the existence of the group itself. And that is very, very important. See, what leads to social isolation sometimes? It's a group of people, they agree to something, and there is somebody who doesn't agree. Then that person sort of becomes the outcast. So these are the things that are important here. Okay, we'll discuss that more in detail when we come into the case study. And the last part is culture. Culture is the biggest influence when it comes to conformity. Because every culture has a certain rules. Every culture has a certain norms, and those norms are passed from generation to generation. Yeah, whether kids like it or not, they have to conform, they have to comply, and for it to be passed to the next generation, that conformity is important. So hence, culture is also very much a factor that determines that conformity. Okay, same culture, you belong together. That is the two things that brings together. Okay, so these are the factors. Now, the most important part is the therapeutic process. The next slide, please. Now, when we are traditional beliefs, now it depends. Now, are the traditional beliefs family specific or are they culture specific? See, if it is family specific, every family can have different traditions. Okay, we follow these traditions. The grandfather is supposed to be sitting at the dining table at the head of it. This is a family tradition. This is tradition. Culture can be something like the culture of a region, the culture of Maharashtra, the culture of Rajasthan, the culture of West Bengal, in that sense. Okay, Gujarati culture, Marwadi culture. Again, culture is a very diverse term. Tradition can also be family based. Okay, but again, the traditions also somewhere tend to have that thing. Oh, how can you not follow? If your cousins are following, how can you not follow? So that is also there. Now, why are we discussing social psychology? Of course, it is a very, very important concept, and man is a social animal. We need to know social psychology because we live there. But the problem arises if there is a person that comes to a therapy session who's probably finding themselves isolated or who's finding that they are having trouble adjusting or they feel like they don't want to be a part of it or they aren't made a part of it. There is no blending happening and hence they choose to stay on themselves. Or you have a group of people, there is a new group of people, and these people are not sort of blending well with this person. This person belongs to a different city, has moved to another city. अब इन लोगों का ऑलरेडी ग्रुप बना हुआ है and this person is like अभी मैं इनके बीच में कैसे घुसूं? How do I now be a part of them when they're already so tight? Imagine this person is an introvert and then moving to a new city, moving to a new college, whatever the environment are, then trying to be a part of this is a tough job. Yeah. And there is a possibility that this person may then not come for you for the sessions. Yeah. Then this is also a very important factor to understand. Yeah. So keep this into consideration. And of course, this group of people meet for a specific purpose. Okay. They are a particular committee. So these also things are very, very important. Now, in the therapeutic process, it is very important, firstly, to identify those social pressures in the life of a person. If a person is coming to you with some kind of issue about adjustment in a new culture, in a new society, in a new place, then are they being pressurized in some way is very, very important. Okay, so in therapy, clients may sometimes express thoughts, beliefs, or behavior that align with societal norms, expectations, but they're not listening to their original feelings as well. I'm doing this blindly, but I feel so unhappy from within. I'm feeling anxiety from within. I feel like I don't belong, I don't fit in. They are coming to you for therapy. So then it is the job of the therapist to help them identify these social pressures. Okay. Then also explore their own values, their own belief systems, their own motivation, so that the two selves that they are carrying in between them, one that wants to conform and the one that wants to believe their own feelings and hold on to their own personality, can find space in itself. Okay, so this is also something that you need to understand. So when it comes to societal pressures, then in which case family also sometimes comes into the domain of that society. Are your parents forcing you to do something? Are you finding extended family forcing you to do something that you don't want to do? शादी में चलो ऐसे दिखो. That is also something that is inherently there in our culture. Rules of another place, a new college, a new committee that you're a part of, a new group that you're a part of, a reading group that you're a part of, a new complex that you're a part of. These things will also come. And then we need to then sit and ask them, "See, do you feel that are there some things that are affecting you and your beliefs? So do you really want to do this? Or are you only doing this for the reason that somebody will be happy?" So those are also very important things. And also challenging assumptions. I assume इन लोगों को ऐसा लगेगा. I assume इन लोगों को वैसा लगेगा. Okay? So clients may sometimes hold the beliefs and also assumptions, sometimes about themselves कि अरे मैं तो ऐसा हूँ, मुझे कौन accept करेगा? Yeah. See, if you have a person moving from one place to another, there is a possibility that person was taunted for something there, was hurt there, and that lens is now transforming here as well. So मैं तो ऐसा हूँ, मुझे यहाँ पे कैसे accept करेंगे? Can just be their own belief system. So we've got to work with that as well. And how do we do that? That time we encourage critical thinking. Okay. Is it rational? Is it irrational? Okay. Do you think this is now the case? Have you explored it? Have you tried going to them? Have you tried meeting them? Have you interacted with these new people? That is also something that you need to do. And also questioning the validity of the societal rules. See, it is not all the time that the person is wrong and the society is right. Okay. If a person is avoiding a place, why? Because there is this underlying belief or there is this thought that he has, and they may be right. Ki every time I go there, I'm put down. Every time I go there, I'm not accepted. I'm always criticized. Yeah. So that can be reality. So of course you have to question both of these. You have to ask them, "Ki, do you really feel it is right? If yes, can you give me examples? As to आपको क्यों लगता है ये पहले हुआ है in this new place or in this particular place?" Okay. So you have to ask them by asking them to give you examples. Yeah. And also see, sometimes a person has certain core beliefs. These are my core beliefs, and I don't feel like going against them. And in which case, sometimes you just have to accept it. Okay. If you feel like, oh, this person is not accepting this right now, or they're not open to this conversation, and there is a client who's slightly resistant to having a conversation, leave it to later point. It's okay. But it is important that you understand that you have to challenge assumptions. Because as therapists, that is one of our big jobs. Yeah. Next slide, please. The next one is promoting self-acceptance. Sometimes a person is so much in the mindset कि I need to be accepted. I need to conform. ये मैंने नहीं किया तो भाई बहुत बड़ी बात हो जाएगी. If I don't conform, ma'am, I will end up feeling guilty. I feel ashamed. I feel my parents will feel ashamed. I feel like my friends will be ashamed of me. Yeah. So what am I doing? Because somebody else is feeling something, I am taking the burden of all of their feelings also. So what about mine? So there, basically, I am not accepting my own self. And sometimes not accepting your own self can be a big thing. Yeah. Of course, then there is a possibility that the client will have a problem, will have problem adjusting. Because then with the friends, with the society, with anybody, they're trying to portray a false image. Inside, they don't feel that because they're not accepting themselves. So we have to somewhere, anytime you have a case which has social elements in it, social influences in it, peer group, family, social media, do you accept yourself? Or Do you feel, correct me if I'm wrong, are there parts of you that you don't accept? You feel this. Yes, you're feeling guilt, you're feeling shame, but you realize you're not doing yourself too much favor. Okay, we need to make the client aware also, so that by having these conversations, by bringing these issues up, we may explore this arena further with the person, because exploration is very important anytime we're dealing with a client, because it is through that exploration the client will find answers within themselves. They will find that rational and irrational belief systems within themselves. Yeah. And once they do that, then slowly but surely they will finally come to accept their true self, and then not worry about rejection from peer group, from society, parents, extended society. Because somewhere it is always me that is somewhere important. Am I okay? Am I truly okay with this? Very, very important question to ask when it comes to dealing with any kind of influences. Peer group is a very, very big factor. I need to keep my friend happy. मुझे नहीं जाना, बट यार मैं मना करूंगी तो इसको गुस्सा आ जाएगा. My boyfriend happy, my girlfriend happy, in-laws happy. What about me? I've attended every single this thing event that they asked me to go to, but I don't want to go this time. I'm somewhere not accepting that I want to say no. I'm not realizing my boundaries. And also coming to the next point, I'm not being authentic. So all of these things you will have to explore anytime you're dealing with a person who's going through any kind of issues when it comes to society at large. Okay, very, very. Next point is exploring authenticity. Yeah. So when it comes to exploring that authenticity, the best place to do that is the therapy room, you with your client, because there is this core necessity that when a client is coming to you, he should not get into the factor कि भाई अभी I have to please the other person, because somewhere you have to understand that usually a lot of people, a lot of clients who are coming to you for therapy for any kind of peer influence, society influence, or social influence issues have a particular driver called please others. I need to please others. Okay? Well, because the self acceptance is not there. Yeah. So then you have to give them that space that they can be authentic. Tell them that whatever they say here, you're not judging and you can accept it. Okay? If they're having difficult feelings, if they feel like they cannot talk to you right now, yeah, they cannot discuss some concepts with you right now because they're not ready. See, a lot of mistakes that young therapists make is that they feel कि immediately पहले sessions में सब हो जाएगा. It takes time. Okay? Even for the client to be authentic will take time. So don't ever feel like I am doing a bad job as a therapist. It takes time. 3, 4, 5 सेशन कितने भी सेशन लगे, it is most important that you build a rapport first with your client. Because once the rapport is in place, because you are a stranger, no, to them as a therapist, you're a stranger. So they cannot trust you immediately. They are not expected to be authentic with you immediately. When you make a new friend, with a friend also you take so much time to get acquainted, to share your feelings. So how do you expect कि भाई therapist के साथ easily हो जाएगा? It takes time, and it's okay. Yeah. So give them that space to be authentic. Yeah. And take time to explore and look into all the domains that they're bringing to you, and independent of societal expectations, because you always have to ask them, what is it that you feel you want to do? Okay, we understand these people, these groups, they expect you to do something, but what is it that you want? That little voice inside of you. So encourage your client to speak about these things, to find that sense of self with themselves. Yeah. And with that, we also have to look into the values of the person कि आपके core values क्या हैं, आपके core beliefs क्या हैं, what are your passions in life, what are your aspirations in life. A lot of times, a lot of young children, they make really bad choices in their careers. They choose a career because, oh, my parents want me to, or it is the cool thing. Oh, my friend enrolled, I enrolled. Many times. So then again, their aspirations. So of course, this is something that you were influenced in. So आप क्या चाहते हो? आपके क्या aspirations? Yeah. What are you looking forward to your future? We have to first start by looking into it, and that will be a huge part of the therapeutic process. Okay. Only when they are able to align themselves with their true selves, when they understand, okay, these are my values, these are my passions, these are my aspirations, and my expectations, then they'll be able to come into their own selves first in the therapy room and then in society. And please remember, authenticity is only cultivated. Okay, it is something that is a process. Just like as a child, we learn how to eat, even that authenticity is a learned behavior. Because again, social psychology, somewhere we are all influenced by our family. Because that is the first environment that we grow up in. Then it is our friends. So that is how it continues. Because once that authenticity starts to come, you will see that your client will start to enjoy a greater fulfillment in their lives. Yeah. And a greater sense of well-being will also be found. Yeah. And the next part, which is also very, very important, is building that self-efficacy. Yeah. And what is self-efficacy? See, when a client is coming to you with any problem relating to social psychology, yeah, there is a possibility that they lack certain kind of ability, certain kind of belief, certain kind of confidence, certain kind of self-esteem issues. A lot of these things might play in. Guilt, shame, very, very important factors, especially today. Embarrassment. I feel embarrassed to put myself out there. I feel embarrassed to put my pictures. I feel embarrassed in the group of my friends. They are also good looking. A lot of these factors may come in. Or embarrassed that I am not of a certain economic level, or I feel like I may not fit in. So there are going to be a lot of issues. Yeah. So then, first of all, there has to be this confidence that you build in when it comes to your clients. Yeah. Start with that confidence. A basic sense of self is very, very important. Once you build that, they will automatically, through the process, start to then resist the social pressures. Yeah. And then, dheere dheere say, along with your support, along with their own support, most importantly, and sometimes even a close group of people, they will then become more efficient. Yeah. And efficient in what? Efficient in making new choices, efficient in making new belief system, efficient also sometimes in building new values and new goals for yourself. Yeah, very, very important. And truly, if I have to tell you, there are a lot of people in this world today who struggle with this. And why is it? The simple reason for this is because the pressure of social media, a certain kind of pressure to be someone, to fit in somewhere, is very, very big issue today. Okay. And even for students of psychology, all of us today, see, we are all in the arena of social media. We see a lot of people in our profession as well putting out huge things, having degrees, having lot of certifications. Somewhere even that builds up. Yeah. But again, it is also important that what is building value for me. This is very important. I need to get this. So focusing on the self is very important there. More than focusing on, oh, my friend is doing it, or oh, these group of people are doing it. Very, very important. Even the kind of person you portray yourself to on social media. Okay, you have to look a particular way. Of course, a lot of movements are now beginning where people are starting to pose in an authentic way. Otherwise, perfect food. We'll look into it. Again, see, there are a lot of issues that can come in. See, not always can we put things in one criteria. Okay, because what you're talking about is a very severe kind of mental illness. Yeah, so not always. It can be very normal. You'll be surprised that even people that live with you, sometimes people who study with you, people who live in your own house, all go through these pressures. So is it then to say they're all going through some kind of mental illness? No. So again, don't ever, and I repeat myself, treat people who are going through something by the same lens. Every patient is different. All the things that you do with people who come to you, treat it case by case. And one core important factor here is don't diagnose immediately. Because the minute you get into your mind about certain kind of diagnosis, that is where you'll make mistakes. That is when you'll start missing the signs. Okay? Diagnosis has to come after a very, very good amount of time that you spend with your client. Then get into diagnosis. Okay. Again, if you're intend to be a psychotherapist, then of course, a very senior psychotherapist called Dr. Jonathan Shedler, he's like, don't get into diagnosis immediately. Build a rapport. Let 5 to 6 sessions go on. And then you are in the position to make an informed decision. Otherwise, you will be a part of those therapists जो देखते हैं patient को एक बार और लिख देते हैं कि भाई इसको ये है. Can you meet a person once and decide about them? You cannot. You have to meet them at least a few times before you get to the diagnosing part. And no, see, no one size fits all when it comes to psychotherapy. Okay? So please take that as a rule. Very, very important. Yeah. Any questions here? Okay. So we will end with this and then we'll be going to the case study part. Okay? Because anytime you want to understand anything, okay, any concept, a case study always helps. And this particular sessions that you're doing, they're very, very case study oriented. Okay, case study helps you understand the finer points in therapy. Okay, unless you've observed, observation is also very important. If you get to do that in hospitals or any place. Right now I cannot, but I'll be giving this PPT to you, so you can of course take a look at it later. Okay, I'll be giving you the PPT, so don't worry. Yeah. So again, when it comes to case study, you have to understand something that learning concepts is one thing, but handling a patient is different. Because there, your skill as a therapist is very, very important. How much you notice about your client, what you notice about your client, that is also very important. Okay, so please remember something that is very important. Anytime you're stepping into the therapy room with a client, whether it is a new client or it is an old client, please remember to treat it as if it is a new day. Otherwise, you as a therapist will carry a lot of baggage. Yeah. The only thing that you need to carry with you that time when you're meeting a client is your skill as a therapist, and alongside your skill as a human being. Yeah, we are all going to be trained in either psychotherapy, we're going to be trained in various modalities, counseling, of course. Of course, yes, absolutely. Yeah, and that is very important. So let's begin our case study. Yeah. Today in this session, we are talking about a person called Riya Mehta. Okay. Again, if you want, you can take down, if you have a notepad, take down certain details so that I may open the floor for discussions and you can give me your opinions as well. Okay. And then we'll get into analysis because again, there is no one particular way of looking at it. Yeah. Again, there are lenses also at looking at a client. Okay, you can have the CBT lens, you can have a psychoanalysis lens, you can have a narrative lens, you can have an REBT lens. A lot of therapies are in. What you choose, you look at it that way. So if you want to make notes, please do that. So the name is Riya Mehta. The age is 15 years old. Okay, so she's very young as a client. Female, cultural background, very important. She's an Indian, comes from a Hindu family. Location is Mumbai, Maharashtra. She is from the 10th grade. She belongs to St. Joseph's High School. Her family, once again, very important, is nuclear family. Okay, the size of the family, because remember, we discussed the size of the group. The size of the group then influences conformity. So here it is a nuclear family. Yeah, so few people will be informed. So that is also very, very important for you to understand. Now, social background, once again, very important. So please remember, anytime you have a client, certain parts are very, very important. Of course, a few of these informations you can include in your informed consent form or the preliminary initial report that you ask your client to send. You can have it in your office or you can send it to a client over email as well, depending on what you're comfortable with. So let's look at the previous history. Social background. Ria is described as sociable and friendly. However, she has recently become withdrawn and has started avoiding social gatherings. Okay, so a person who's actually sociable, actually friendly, recently has become involved. So there is a time period. So कुछ तो हुआ है इसके बीच में. Because the key word here is recently. And has started avoiding social gatherings. So what are the social gatherings that she's avoiding? Very important. She was actively involved in extracurricular activities. Yeah, so very active socially as well. So no reason unless something has happened to withdraw, like dance, theater, but is dropped out of these programs in the past 6 months. Okay, because again, dance is something that is very, very social, needs a group of people, can be solo as well. But theater, of course, a lot of people have put together a theater group. Acting, of course, there are co-actors. So ideally, she may have been around a lot of people before as well. And she's dropped out in the past 6 months. So again, we have a framework. कितना time period? 6 months. So 6 months में she has dropped out of these programs. Yeah. Next, the family dynamic. So Ria lives with her parents. So she's not living alone. Of course, she's 15 years old. Again, hence it is important कि वो कहाँ रहती है. Again, ये foreigner का case होता, दूसरी countries का case होता, या फिर India में भी if she's away from her family for education, then that would also have been a different thing. So यहाँ पे उसकी family dynamic हमें पता है. That is also very important concept. Lives with her parents and younger brother. Her father, a marketing executive, often travels to work. So father is not always present with the family. He travels for work, marketing a job which is very busy. And her mother is a homemaker, is very protective and concerned about Ria's well-being. So you have a mother who's protective. Okay. Very important. The family has recently moved to a new neighborhood. Okay, so there has been a movement. So एक जगह पे जो चीजें familiar हैं उसको छोड़ के new environment में they've gone, which is added to Ria's feeling of isolation. Okay, again important points to note. So you have to understand कि ये चीजें आपको लेनी जरूरी क्यों है. See, I'm sure a lot of you, if you're master students, if you're not, you will learn. We are taught case histories. Why? क्योंकि आधे details, if you're taking it properly and you're studying beforehand as a therapist, आपको इन चीजों में मिल जाते हैं. So paying attention here as a therapist will be very important for you. Yeah. Let's look at the social history. Now, what is the social history? Friendship. Previously, Ria had a close-knit group of friends, but has began to feel that they are drifting away from her. So had a close group, but now drifting away. She has expressed feelings of being judged, okay, left out, particularly after an incident where she was inadvertently excluded from a friend's birthday party. Okay, social media presence. So Ria is active on social media platforms, but is reported feeling pressure to present a perfect image online, which has contributed to her anxiety and feelings of inadequacy. Okay, you have a social media impression as well. Now, psychiatrist history. पहले इसके पहले कोई प्रॉब्लम हुई थी मेंटल हेल्थ को लेके और नॉट, we'll take a look at that as नो फॉर्मल डायग्नोसिस, तो प्रॉपर डायग्नोसिस तो दिया नहीं था किसी भी थेरेपिस्ट ने या फिर साइकेट्रिस्ट ने, डायग्नोसिस नहीं दिया था, सो नॉट फॉर्मली डायग्नोस्ड with any mental disorders. Okay, next is behavioral changes. Teachers and parents have noted that she has become more introverted, often preferring to stay at home rather than engaging with peers. Physical symptoms. Ria has reported experiencing increased heart rate and sweating when faced with social situations, indicating possible social anxiety. Again, what is the presenting complaint? Ria has come to therapy expressing feelings of loneliness, anxiety regarding social interaction. She's concerned about her ability to connect with her peers and feel increasingly isolated since the move to a new neighborhood. All right. So right now, as we have spoken about whatever is it that Ria has come with, what are the factors that you as students of psychology or normal any background, what are you picking up? Let me know. Palak?
Yes, ma'am. I think it's regarding to the peers that recently happened about the social gathering, and because of which she is thinking that she is not enough, or like she is not good enough to hang out with people and to present
Yeah.
herself outside, and that has increased her overthinking, anxiety, and everything, and has um, everything is plus because of the new neighborhood also. So I
Yeah.
think yes.
Yeah. That's very nice. Anybody else? Yes, Swati?
Yeah, so there could be a reason of bullying. It
Yeah.
could happen in a social circle, which is very much evident nowadays. It
Yeah.
could be, online or offline as well, and where children they feel, they feel fearful to, disclose it to their parents or the teachers. Or
Yeah.
it can be over criticism, be it in their social circle, or be it from someone, like they are really they look up to. And thirdly,
Yeah.
as said by Palak, the change in the place, the neighborhood where she has moved into, maybe she's like trying to get along with that, and she's not able to adjust with the surroundings or the company, like, the friends, the social circle. She's not able to, so she's facing a challenge between FOMO and fit in type of situation.
Yeah.
She's into that dilemma.
Okay.
Thank
All
you.
right. Somebody put a comment in the comment box. Would you like to speak? Swati, you have something else to add? Your hand is raised, which is why I asked.
Yeah, so I just want to add one more thing about it. See, many a times, we often overlook the concern like PTSD also. People usually
Yeah.
withdraw when they have a incident of PTSD, be it can be a minor sexual harassment or any mental harassment as well, So social
Yeah.
anxiety is also related to it, where people tend to withdraw from social groups, they go into that zone of social isolation. So it could
Yeah.
be a reason. We can obviously we can look into it.
Yeah. Yeah. Absolutely. Lot of areas. Yeah, Palak.
As Swati said, it can be a minor comment that might have grown because of certain incidents that recently happened. Yeah.
Okay. Yeah. Yes. Yes. Very interesting. Absolutely. Yeah, Sukirti.
Yes, I would like to add one more thing. As much as Ria is trying to go to the social gathering, there must be ignorance or avoidance from the peers. The peers might not like her for who she is, or they might find some kind of fault, and that is making Ria to fear to go to those kind of social gatherings also.
Yeah. Yes, absolutely. So you say in this case itself, there is no single thing that we can point out. Okay, there are a lot of things here that can be influencing her. Okay, so when it comes to that, we have to always ask the patient. Okay, she's 15 again. Who got her to therapy? Was it her father? Was it her mother? Sometimes we also can talk to the parents. Okay, lot of ways we can handle this particular session with the client. Okay, we look into it further. So Ria herself is telling us that she's feeling isolated and anxious, especially about social interactions. She's also concerned about her ability to connect with her peers and feels, totally isolated. Let's look into it. Now, another very, very important component, which is very important, especially when it comes to clinical psychology. Counseling, you can do it, you cannot do it, it is always optional, is mental status examination. Okay. So mental status examination is something that starts from the minute the client walks into your office. जैसे दरवाजा खोला वो क्लाइंट आया आपका जॉब एमएससी लेने का तब से स्टार्ट हुआ. Yeah. What are the things that we can look into? Appearance. Okay. कैसे दिखता है? What are the clothes that they are wearing? Are they dressed up properly? Is it inappropriate? बाल कैसे हैं? बैगी कपड़े पहने हैं, छोटे कपड़े पहने हैं, इज इट फिटिंग देम? इज इट प्रॉपर इन कंडीशन? इज इट ironed? Is it appropriate for a therapy room? Or is it appropriate while stepping out of the house? Okay, are they neat in short? That is what we're looking at. So we will take a look at that. When it comes to Ria, she was neatly dressed, okay, and appears her age. Also is important, does the client look their age? Okay, and when we are talking about that, we also have to consider कि अरे facial expressions कैसे हैं? Are they looking older than their age? See, sometimes even too much stress causes the person to age prematurely. So when we are taking into consideration that appears her age, we are taking into consideration कि अरे इतना stress है कि उस वजह से premature aging भी हुई है कि नहीं. Okay. Next is behavior. Cooperative, non-cooperating. Yeah, in her case, she is cooperative, but she is fidgeting. Okay, and fidgeting is one of the core signs of anxiety. Okay, fidgeting. यहाँ पे, whatever it is, touch something. There is certain kind of fidgeting happening. Okay, so the display is there. Speech. Now, speech can be a lot of varieties when we're taking into mental status examination. But with Ria, it is clear, it is coherent, but sometimes hesitant. Okay, so hesitant. She is not willing to open up right now. So which means ki, okay, isolation from the therapist is also there and she may not be comfortable. And of course, you also have to understand that sometimes when it is a client who is going through anxiety, then that hesitancy is very normal. क्योंकि therapist के office में आने की भी certain anxiety होती है. Yeah, so that is something that you may have to note. Mood, anxious. So already we can see that anxiety can be something that she is going through. अब level कितनी है वो देखना पड़ेगा. Okay, or will this level continue in the next sessions also? That is also something that we need to see, because you have to remember there is a possibility कि आते हुए anxiety है. They waited for a particular time, they got into communication, they felt a little bit more comfortable and they went. Next time they came, you are seeing कि भाई anxiety कम हुई. So we have to give a chance here, and hence that this is what I'm telling you. Don't get to immediately calling it array anxiety, diagnosing the major, but keep it at the back of my mind that this is a possibility. Okay. Reports feeling of sadness and loneliness. So she is sad, she is feeling lonely. Okay. Thought process, logical. Okay, she has logic. So there is also insight somewhere. How much we'll have to see. But also preoccupied with social fears. कुछ तो social fears हैं इनके मन में. Okay, here we also have to get into detail that how is she talking with you not only during mental stage test examination but also later. Cognition, okay, is she alert? Thoughts coherent है क्या? Whatever they are talking about, is it making sense? Sensible है क्या? Is it to do with here and now? Is she able to describe whatever is it that she's experiencing? Cognition, thoughts, yeah, and oriented to time and space. So there is a possibility that Riya is. So she knows she's in the office of the therapist. ये time हुआ है and she is located in a particular place where the office of the therapist is. Okay, so we have that about Riya. Insight. It is limited. So she is understanding that she is lonely. She feels there is a certain kind of something that she is missing. She understands कि socially problem हो रही है. But there is also the struggle when it comes to her anxiety. She doesn't understand anxiety. She's 15. Age also is very important. Okay. So, of course, media is making people aware कि भाई anxiety होती है, but she's not aware. She's a young child. So you have to take it into consideration कि यहाँ पे insight भी है, social anxiety का insight नहीं. Okay. So that also we need to take into consideration. Judgment. Okay. Poor. Okay. So मुझे जाना है. I should get over my fears and I should see भाई हर वक्त यही होता है या ये वक्त जाके कुछ अलग होगा. तो यहाँ पे उनका जजमेंट जो है थोड़ा प्योर है. Why is it poor? Because now something happened. One incident can be major, can be two, can be major, but she started avoiding it entirely and she's not afraid because of it as well. So there is also fear involved. Okay, that part is also there. Now the genogram is also here. So again, in the genogram, this is almost like a family tree, if we are to call it. So here you have Ravi, the father, the mother Nina, Ria, 15, so the older sibling, and you have Ayan, who's 10. Yeah. Again, in the genogram, we are again taking that into consideration. So when discussing the brother, because the father and the mother part we've already discussed. Now, important. The brother is there who's younger, has a close relationship with sister. And this is the chap who looks up to his sister. And he adds that Riya's pressure appears to be fine. So 10-year-old को लगता है कि भाई ठीक ही है, इतना कुछ है नहीं. Okay. So that is one thing that we are getting, that there is a possibility that the brother hasn't sort of noticed something that is true. Okay, this is just for our understanding. Now, one thing that you need to know that when it comes to anything that is socially oriented, anytime we're looking at a client जिनको social problem है, शायद वो esteem की problem है या फिर उनको anxiety की problem है या फिर friendship की issues हैं. We'll take a look at that later. So there are certain scales that are available. Okay. So here, what has happened is here the testing has happened immediately. Now you have to remember that as a therapist, it is up to you कि आप tests कभी देते हो या फिर आप टेस्ट देते हो कि नहीं देते हो. Or you take it according to client basis. Okay, it is up to you. But of course, because we are getting into this case, we are giving you the names of these tests and they are easily available. Okay, so the very first one, because we've tested immediately, is the social anxiety scale for adolescent. Of course, she falls into the category of adolescent. अगर वो adult होती, तो यहाँ पे we could have also given Beck anxiety test because there are a lot of tests. But here, the social anxiety scale for adolescent is meant especially for adolescent under a certain age. So यहाँ पे we can already see the score that she's received is 28 on 40. So although 28 is a decent number, okay, we'll call it decent because you have to moderate anxiety. It is not very high. Yeah. But again, it is coming into that level. So we have to work on it. We have to take action, which means anxiety के ऊपर we have to work. तो ये टेस्ट देकर ये तो हमने साबित कर लिया कि एंजाइटी इज एन इशू मॉडरेट लेवल का है हाई तक जा सकता है इफ नॉट ट्रीटेड सो द टाइम दैट शी इज कम फॉर थेरेपी इज एक्चुअली द राइट वन क्योंकि 28 का स्कोर है या विल गेट इनटू इट या द नेक्स्ट वन is the Rosenberg self-esteem scale. Okay, now again we always already discussed this that when it comes to the self-esteem part, because there is an issue of having self-esteem. Peer pressure हो सकता है because we've already seen there is a certain kind of peer group involved. Yeah. And here it is below average self-esteem. सेल्फ एस्टीम में भी प्रॉब्लम हुआ है. अब ये क्यों हुआ है, किन कारणों से हुआ है, यू विल फाइंड आउट ऑल ऑफ दिस when we are talking with her in depth in the sessions. So again, the score here is 16. Friendship quality scale. What is the quality of her friendships? Okay. Are they very close? Yeah. Are they interactive? Can they depend on each other? Can she reach out to her friends? So all of these things are there. But here also you can see that there is a low quality of friendship. The score is 22. So ideally, now we realize after we've given the test कि यहाँ पे सारे एरिया है जहाँ पे हमको काम करना है. Which means ideally Ria needs to be in therapy and ideally once a week तो उनको मिलना ही पड़ेगा. Yeah. Here is another important question कि भाई initially you know a lot of parents ask कि भाई how frequently is it needed? कितने sessions लगेंगे? Because of course finance is involved. So in the beginning, don't ever feel like कि भाई 4 सेशन में हो जाएगा, 5 सेशन में हो जाएगा. Just tell them भाई it is the initial session. Let a few sessions happen. I'll be able to give you an informed decision only then. Okay, that is something that you can put up. So here we know already कि काम करना है और multiple issues पे काम करना है. We have to have conversations around the self-esteem. We have to talk to her about her friendships. Now friendships में we have to talk about her friendships before and after also. Because remember, she was very, very bubbly. She was a happy child. She was a very sociable child before. तो वहां पे फ्रेंडशिप्स क्या थी, तो यहाँ पे क्या अलग है. Okay, self-esteem again. How was it then? Was she comfortable? Was she able to hold up on her own out there? और यहाँ पे क्या हुआ? And again, anxiety. Yes, certain kind of anxiety issues have come, and we already have certain amount of data कि प्रॉब्लम हुआ है, कुछ सोशल इंसिडेंट की वजह से प्रॉब्लम हुआ है. Okay, and I already have asked these questions ki what are the social factors which may have caused it. Okay, so we'll get into all of these questions so you will understand कि therapy setting में इन चीजों के साथ we'll have to deal. Now, social factors. Okay, what could have contributed to her anxiety and feeling isolation? And a lot of you were able to sort of explain it really beautifully. We'll look at it in details. Now, Ria's problem seems to be some kind of a combination. It is the situation also that has changed. कि भाई घर बदला, स्कूल भी बदला, फ्रेंड्स थे, फ्रेंड्स भी बदले. सो रिलोकेशन इज द फर्स्ट थिंग. सो रिलोकेशन में तो कितनी सारी चीजें आ गई. नेबरहुड बदला, तो फ्रेंड्स हो सकते थे भाई, बिल्डिंग के भी फ्रेंड्स हो सकते हैं. एरिया में आई फील कंफर्टेबल, आई फील सेफ. देयर इज स्कूल, बाजू के बिल्डिंग के फ्रेंड्स, देयर आर लॉट ऑफ फैक्टर्स हियर. So that relocation itself is a big factor for her that has been disrupted. So उसका social network बदला है. Social network बदलने के कारण there is also a disconnection that she is feeling. And for an adolescent at the age of 15, it is very important. Friends are like the epicenter of their life. Okay. So again, she is getting into an environment जहाँ पे पहले उसको emotional support था. Now she is not having it. Completely unfamiliar. It is like a fish out of water situation for her. And now it has intensified her feeling of isolation. She doesn't feel secure anymore. That is also something that needs to be looked into. Possibly, there is a possibility कि भाई अब I'm not able to get into these people or I'm already dealing with some other factors. कि घर पे adjust करना, rooms के साथ adjust करना, वो भी हो रहा है. Neighborhood, lot of issues, no? Peer dynamics. तो यहाँ पे जिस new school में गए हैं, what are the kind of social groups available? Are there open group? Are they a closed group? Culturally, are they similar? Okay. Are they accepting of Ria? Are they warm? Are they friendly? Okay. And see, when it comes to adolescence, see, हमारे groups बने हुए होते हैं. And we have an entire atmosphere that is going on in groups. We have all been in class 10. Yeah. तो उसमें नए इंसान को भाई accommodate करना as a group, it is going to be challenging. Who takes the initiative? Do people take the initiative? So all of them are there. Any person who comes new, there will be judgment. It is somehow the unsaid rule, especially at that age. And that is also heightened that, okay, I want to please them, I want to make a good impression, but there is a possibility they're judging me. Social media pressure. Already there is a social media pressure. So there is a possibility this kid wants to fit in. Yeah. And when it comes to adolescent, even later, college student also, a lot of our life is related to our social images. Yeah. Presenting a perfect image. फोटो इस एंगल से लो, ये फिल्टर के साथ लो, इन चीजों के साथ लो, so that I get certain likes. उस पे मेरी सेल्फ एस्टीम बिल्ड है, डिपेंडेंट है. सो ये भी फैक्टर्स है. सोशल मीडिया उसके ऊपर प्रेशर क्रिएट कर रहा है. रिमेंबर शी इज मेड सोशल प्रोफाइल इनएक्टिव. दैट आल्सो बी नीड्स टू बी लुक्ड इनटू कि इतना क्या हुआ कि सोशल प्रोफाइल भी इनएक्टिव कर ली. कुछ हुआ वहां पे. फैमिली डायनामिक्स. Again, family dynamics may also you have to understand that father travels. Father will support the child. Every father does, but he's traveling. Traveling के अपने झंझट होते हैं. Okay, he has his job. He has to also deal with having the family shift, possibly financially also, because the mother appears to be a homemaker. So how much will he also do? Jobs are important. Deadlines for a father are important. So then, how much of a family support is she getting? How much is the mother supporting her? Brother, he's like, ये तो fine है. He's 10 years old, very young. Okay. So again, although Ria is moving, family is there, but are they able to give her the support that she is needing at this point? And again, she may also feel कि भाई, if I talk too much, I place a burden on my mother who also has to take care of my brother. ये alongside ये अलग हो गया कि भाई father भी नहीं है, mother is also alone. And girl child very close to mother possibly. तो pressure वहां से भी आएगा. I need to be a certain kind of a daughter possibly. Yeah. Self-esteem issues. Again, when it comes to the Rosenberg scale, it indicates struggle तो है. Struggle self-esteem में है. So there is a possibility certain kind of social acceptance, online, offline, is important to her. Yeah. When she came to this new place, was she not accepted? Something happened online. Nobody's liking her photos. कुछ तो हुआ. Low self-esteem और नीचे चली गई. Did she hear a remark about somebody in the classroom commenting about her? Were the teachers unkind? All of that. So social factors में इतनी चीजें वहां पे हमें already पता चली when it comes to this person. Yeah. And again, when it comes to understanding the social dynamic from the perspective of an adolescent is very, very important. Because see, age भी होती है. Age is a very important factor. So there is a possibility अगर एक adult move होता नई जगह पे तो वो चीजें इतनी इंपॉर्टेंट नहीं होती. मे बी द सेल्फ एस्टीम वुड हैव बीन बेटर. एंजाइटी नहीं होती. अडल्ट के स्किल्स डिफरेंट होते हैं. छोटा बच्चा होता है, एडजस्ट करना इजी होता है. बट हर एज इज ऑल्सो वेरी ट्रिकी नो. 15. अगेन इवन कॉलेज स्टूडेंट होता. सो दैट एज अप्रोप्रिएट थिंग्स नीड टू बी कंसिडर्ड हियर. सो वहां पे what are the things that are is needed to be asked upon. Okay, because she is also at an age where she is developing her identity as a person, as a girl, as a student. Okay. So here also the lens of a social psychologist will be very important. And hence the training in social psychology is very, very important. Yeah. And again, as a therapist, you have to tailor what you're doing with her, depending on her age, her expectation, her emotion, her values. Now, the first thing is social influence and peer pressure. Yeah, that is the lens that you need to take into consideration. So adolescents are heavily influenced by their peers. Ki my friends are wearing this, I need to wear this. They're having a pajama party, I need to go. They're going for a certain movie, I need to go. Yeah, but now this is not happening. So social influence किस type का है? Was she asked for something and it was denied? तो यहाँ पे एक party हुई थी. She was not invited to that. Okay, so again, social influence, peer pressure, ये होता है. So again, this is also there. Had the peers been good, she would have been empowered. But यहाँ पे communication of the peers are also important. There is a possibility यहाँ पे भी judge किया गया है. What is the reason she was not invited? So all of these things we need to ask. Okay. Now, the techniques that can be used is CBT, the thoughts that she's thinking. Okay, CBT can be used if you use the CBT lens. Yeah. So identifying certain thoughts inside her that come under cognitive distortions. कि भाई ये इंसिडेंट हो गया तो ये बहुत बड़ी चीज है मेरे लाइफ में. लार्जर देन लाइफ उसको बनाना, दैट इज कॉल्ड कैटास्ट्रोफाइजिंग अ पर्टिकुलर इंसिडेंट. जहाँ पे another person in a place would have been like, oh, chalo, just one invitation and knew there is a possibility I'm not included. Fine. Maybe I'll be included later. But in Ria's case, there is certain cognitive distortion and she made it larger than life for her. Yeah. And now she felt that I am not invited once. I may not be invited and there is a judgment that people are holding against me. एक बार decide कर दिया इस group में तो permanently decide कर दिया. So as a therapist, there you have to help her understand this. Are you taking things a bit too far? Are you catastrophizing things? Yeah. So there we also have to help her see things from a different lens. Okay. So that the way she views the situation also becomes balanced and realistic and she opens herself to different possibility in her life. Okay. CBT can be useful there. Also, there is a possibility that her social skills have not sort of developed that much. Of course, adolescent, but also here because it is a new setup, she has to learn new skills, new social skills. Okay, वहां पे लोग अलग थे, कल्चर अलग था, यहाँ पे अलग है. I need to be taught certain new skills, appropriate skills, so that now Ria has the possibility to engage with her peers in a different way. Yeah, so this is also important. And for that, teaching communication strategies are also important. So what happened? She was not invited to a party. Did she stop speaking? Did she then approach those people? Was it still a friendly environment? Okay, there is a possibility भाई भूल गए, एक को लगा दूसरा बुलाएगा, दूसरे को लगा तीसरा बुलाएगा, इसमें भूल गए. Again, यहाँ पे you have to build skills. You have to be a little stronger here, a little bit more resilient. Because again, when you grow up to be a person, when you grow up to be an adult, there is a possibility there will be other events where you will not be invited. एक तो नहीं होगा. So we also have to then, as a therapist, ready her for a future. Okay, this is also important. And again, यहाँ पे ना, because she is also isolated as a person, नए फ्रेंड सर्कल नहीं है, घर पे सपोर्ट है लेकिन उतना नहीं है. Okay, one good way to do that is individual sessions. So of course you can take. But if as a therapist you have the possibility of also taking group sessions, अगर आप group sessions लेते हो as a therapist, तो आप उसको group session में भी introduce करवा. So automatically what will happen is she will be around people her age. Yeah. Or there can be local groups as well. उन groups में, you can ask the parents, why don't you enroll her for certain classes? Something that she enjoys, dance classes. Okay, that is also possible. So again, social building skills make group therapy is also very, very good and very efficient. And sometimes, if you find a client is struggling, individual therapy may sometimes group therapy works. So don't rule out the work of group therapy. Okay, because again, if she's not being able to open up or she's really feeling isolated, then again, maybe with a group, similar age, she'll start to feel comfortable. She'll start to feel safe. Okay, and again, there also she might receive feedback from the therapist and from peers as well. And peers were probably a lot more supportive. Okay, and that also is there. Again, When you're wearing the lens of a social psychologist, another thing that you need to help them see is the dynamic of social media, the world of social media. Ria has been impacted by certain aspect of social media. We've all seen that. What are the aspects we need to find out? Okay. Was it bullying? Again, Swati pointed out, cyber bullying also happens. Because यहाँ पे प्रोफाइल इनएक्टिव की है, तो अगर you felt attacked, तो कहाँ से हुआ? Was it the peer group? Was it the school group? Was it some other aspect of social media? Because it is a dark world, the social media. Comments में there are wars. People are supporting one against the other. There is genuine hate there. What happened? And how to protect yourself. Okay? How to then fos- foster an ability where you will be strong in spite of the social media dynamic. Okay? And also please make sure when you're seeing that is a problem, offline activities encourage karma. Okay, that is something we already saw. You want to meet your friends, you feel lonely, go meet people. Because you know there are groups online, but they have offline meetings too. Go be a part of those groups. You might find peers there. You might find people you like. So then social media पे time spend करना कम करो. Very, very important. That is something that you have to teach her. Okay, because that will reduce that aspect of her. Okay, and if her anxiety is around her appearance socially, her face, what she's putting out to be, others are traveling, I'm not traveling, what is happening, then that way also she'll be a little bit more relaxed. So social media dynamic you have to address, and please understand anytime you have a client who is of a young age, that influence of social media, the influence of peers, you need to take it into consideration. You need to have dialogues around it because those are very, very important dialogues. You learn a lot about the person and you learn a lot about the self-esteem. कितने level की है. Okay. Next one, encouraging family involvement. Of course, see, immediately we cannot get into the social part. Okay, we cannot force her friends to be there for her. We cannot help her get into a new place. We cannot build another network unless she's getting into group therapy. But family is most important, no? The role of family is crucial anywhere. So then, psycho-education of the family is also very important. And also helping them build better family dynamics. Yes, we understand the father has to travel. Yes, we understand there's a marketing job. The mother also might be busy. The mother has to settle the house. The mother has to take care of possibly cooking, the house, the younger chap who's in the house. But again, newer dynamics need to be built. Okay, and how can they build? Only through a certain kind of social education. She's feeling anxiety socially. Let her not feel that at home. And let her not feel like she has to also carry the burden of her mother. Because if that happens, it will be very difficult. So then a family kind of a meeting is also very important. So encouraging that family involvement will also be very important. Okay. The next part is what role does social media play in Ria's self-perception and anxiety levels? How much of it is influenced? So again, how much of her identity is based on social media? What is she viewing? Okay, where is she spending time? See, again, what happens is we look at a lot of OTT platforms as well. There are a lot of content, especially oriented toward adolescent as well. Okay, age oriented. And a lot of time, there are kids who develop their identity based on character or characters. Oh, this person has worn this. I need to wear this too because I need to emulate them. I need to look into them. So that time, what happens, the identity of that individual, the identity of that adolescent or even an older person becomes very curated. But now it is your job to sort of help them find themselves as a person. Okay. So social media may be curated identity. So again, idealized version of life. Is the person who's coming to you looking at them and being like, oh, I don't have this, I'm a failure. I have not reached this level as this influencer has. I may not be good enough. Somebody is putting out some content, same age group. Look at the knowledge level. I'm not that. Okay. Everything on social media sometimes can look perfect. But how many times will you find that people share the times that they're very unhappy or the times when they're really going through a lot of hard stuff? Very rarely. Because that time what happens, there will be very few people who stick to watch that. Others will be for drama. But others, like, okay, you're just being very unhappy. I'm not going to watch you anymore. Yeah, that happens. So, any identity or most identities, I will not generalize it, are curated. They're made so that an image is presented to the people following or to the people looking. Yeah. So, then is Ria feeling pressurized to do look that way? And is she also trying to showcase the perfect life? Is that creating anxiety? I'm not looking perfect. My face looks a particular way. Okay. I'm not looking this perfect. I'm supposed to look perfect. Is that also creating anxiety? That also needs to look into. So, yes, online persona is the reality of today's age. But what are you putting in? And how much of it is oriented towards perfection, towards fitting in, to pleasing somebody out there, or to being a part of the current age? That needs to look into. Okay, so if she's having any kind of pressure to these social norms, then that needs to look into it. Again, socially also you need to look into the dark side of, you know, the social network. Okay, bullying is very real. Being targeted is real. Okay, so that also needs to be looked into. So these are also things that can sometimes create social anxiety and self-esteem issues. And we've already seen she has it. Now, where is she picking up the self-esteem issues from? Peers, society, or through platforms? That needs to be taken into consideration. There is a possibility the child is okay when it comes to college or school और people around, लेकिन online सर पे सवाल, तो उस पे ध्यान देना पड़ेगा. Again, comparisons and envy. Remember, here we are discussing the social media aspect of it. And remember, each one of us is followed by our friends. Okay. And somewhere that comparison happens if we are of the same age, especially if you are of an age जहाँ पे being influenced is very easy. And there is a reason why certain people are called influencers. Their job is to influence. Okay. So यहाँ पे there is a product that is very popular. One has it, others don't. Okay. And somebody in your friend circle or somebody you're following has it. Then there is a possibility I'm comparing myself to them. There is a possibility the feeling of envy might come. Okay. And is she then evaluating her person, her sense of self with likes, with comments? Is my self worth depending on likes and comments? Followers? Array, my followers, I haven't even gone beyond 50. I haven't even gone beyond 1,000. Oh, look at my friend. What am I doing wrong? I feel jealous. She's going on a holiday. I'm not able to do that. I'm not cool enough. Comparison, envy. Okay? I'm not able to do that. My self esteem is suffering. This person has no friends. Very socially popular. I'm not socially popular. Okay? And then the comparison can intensify certain feelings, sometimes also intensify the feeling of social isolation. I'm the only one who doesn't have it in my friend circle. I'm the only one who doesn't have it in my social circle. And that is causing me to feel inadequate. And is there a possibility these beliefs are being internalized? Okay. And then the standards are not being met. Is that what she's holding in her? So all of these things, the comparison, the envy, we need to take it into consideration. Again, cyberbullying, a very big thing. The reason we connect with absolute strangers. If you have an open profile, anybody can follow you. Okay, certain, of course, rules are placed around. You can add people to accepted, not accepted. You can deny. Of course, that is there. But there are certain conditions to it. If you want to be famous, you will open your profile. You'll allow anybody to then follow you, reach out to you. And if you're a person who's very friendly, understand age is also a big thing when it comes to someone like Ray. Okay, 15 is a very small age. Yeah, so cyberbullying can really happen. Social exclusion then will feel very real. Yeah, and bullying, there is a possibility people might be bullied, but they don't speak about it. They don't talk about it with other people, sometimes not even friends. They deal with it all on their own. Why? They're feeling afraid. And people who bully, people who harass, they instill that fear also. Of course, yes, Madhura, very accurate. Yeah. And again, the fear of bullying also then can make a person feel very anxious. So, did that happen? Was she going through cyberbullying, which led her to make her profile inactive? Of course, one incident happened which not including her in the party. लेकिन was that the only thing? या फिर ये एक था, ये दूसरा था, या फिर the people who are in school, are they cyberbullying her? A lot of angles that we can consider here, which is now leading her to isolate herself and avoid behavior, social behavior. पहले नॉर्मल बाहर जाने वाली बच्ची अचानक घर पे बैठ जाती है. Somebody who had lot of friends, lot of people who are with her, okay, in her previous place, यहाँ पे आके क्या change हुआ? Okay, there are a lot of movies, lot of OTT series made around these concepts, and they're made to make you aware as people. Okay, lot of criminal activity also happen. Yes, so those also things you need to take into consideration. Okay, feedback and validation. So of course, adolescent validating. I need somebody else to validate me. I need somebody else to tell me I'm beautiful. I need somebody else to tell me I'm intelligent. I need somebody else to tell me that, oh, this is great. Otherwise, I don't feel like I'm a person. Okay? Which means again, low self-esteem. Are you able to take negative feedback? Because if you're opening yourself to the world, कभी तो negative feedback आएगा नहीं. Yeah, sometime. Okay? Is she able to take that negative feedbacks? If a person had one negative interaction with somebody, does that become a rule for everybody? Again, like Ria in this case, yeah, एक activity से she was barred. Did she take it as my presence is not validated? My sense of self is not validated. I feel like I'm rejected. Did that happen? Is that why she withdrew? Is that why she started feeling very anxious? So those are also important things. And then you also have to help her as a therapist to see that in society there are going to be two kinds of feedbacks. There will be people who will not like what you do. They say you can be the best kind of a mango or a peach, or there'll still be people who will not like mango or peach. So everybody at all point will not accept you. Some will reject you. You have to learn to be okay with it. Otherwise, क्या होगा? She'll start sitting at home. She'll not go out. Social anxiety बढ़ेगी. Okay? So then we also have to help her build her sense of self, that even if you're getting negative feedbacks from some people, doesn't mean that you're a bad person. Doesn't mean others won't accept you. The right kind of people in the right kind of circumstances will. That is how the world works. That is why we have groups. That is why we have groups that work against each other also, no? So there's never going to be a situation where sub accept kar rahe hain. Validation, self-esteem, very important. Yeah. So then it is important for her to build that sense of self. Ki I am okay the way I am. I can be real. My feelings are valid. Very important. Distraction and withdrawal. You see, again, social media offers a sense of connection. There's a good part of social media also. I'm not saying there are all bad parts of social media. Okay? But sometimes it can also play the role of distraction. A person can get so involved with social media that real life social interactions don't happen. How many of us now take the time to actually meet up and how many even take the time to buy phone उठा बात कर WhatsApp, Snapchat? Are we meeting people? Are we gathering in places? Are we just to talk every week? So this day we decide we're going to meet. This day we decide we're just going to chat. Not on WhatsApp. WhatsApp and these media places are also places that bring out a lot of disconnection about people. So ऐसे कहा I felt you said it like this, by other is like I was not even saying it like this. I meant it this way. Finding out the tone in the WhatsApp messages, tone in the messages. That is also happening. So lot of conflicts, lot of distancing, lot of withdrawals from each other. Yeah. So then distraction and withdrawal is very, very real. This is a problem in a lot of people, and a lot of people come to therapy for this. They do seek therapy. And then it is your job to talk to them and help them to confront anxiety. कुछ लोग face to face नहीं बात करना चाहते. They feel, oh my God, I come face to face, there's got to be something. There is a social kind of anxiety as well. Yeah. So again, withdrawal. Why is it happening? Do you need to withdraw? How can you put yourself into social situations where you talk to people, you meet people? Very, very important. Okay? And social media can be good, can be bad. And trust me, a lot of problems that will come to you as therapists, social media will have couples, social media. Very normal. Okay, because people are very, very accustomed to it. Okay, so healthier relationships are ones that are built offline. Where of course you're meeting online, distance is a real thing. लेकिन offline भी है, especially friends के साथ, peer group के साथ, same age group के साथ, so that there is a healthy, sort of a symbiotic relationship that will develop. Okay, very important. And real life connections are important. It is not only about your Instagram, Snapchat, OTTs. Take time to connect. That is what you need to teach the clients who come to you. Okay, as therapists, this is what you need to be aware of as well. Okay, because social psychologists have a very important job to play even in the future. Okay, understand this. We have a lot of reels. Okay, reels हैं. हम 30 minutes, 30 seconds के देखते हैं, 20 seconds के देखते हैं. Lot of people come to you कि भाई कुछ नहीं कर रहे, भाई बाजू वाले से बात कर लो. No, reels. How will social connection happen? Previously, people who used to sit together used to talk to each other. वैसे नई चीजें बनती थी. Even in gardens, even in local places, building की garden, people are not talking. Again, mobile, कानों में. Social psychology. How is your society changing? Of course, people will come to you with these problems. One of the most important lens for you to have as a therapist is the aspect of social psychology. Her area में, not only in the case of Priya, everywhere it's going to be important. Family dynamic, open communication. Is the family talking to each other? Is Riya able to share her challenges with her family? क्या हो रहा है, क्यों हो रहा है, ये नौबत क्यों आई कि थेरेपिस्ट के पास ले जाना पड़ा. आइडियली पहले के टाइम में इफ किड्स हैड प्रॉब्लम फैमिली के पास जाते थे. अब ऐसा क्या हुआ, ये फैमिली, इज इट क्लोज्ड, इज इट वेरी स्ट्रिक्ट, ये करना है नहीं तो नहीं चलेगा. ओपन कम्युनिकेशन है पेरेंट्स में, बिकॉज इवन द यंगर किड इज लाइक शी इज फाइन, ऑफ कोर्स ही इज फाइन, ठीक है. व्हाट अबाउट फैमिली, व्हाट अबाउट पेरेंट्स. ओके, आर दे वैलिडेटिंग हर फीलिंग्स और आर दे टेलिंग हर कि भाई कुछ नहीं, यू विल बी एबल टू डील विद इट, सबके साथ होता है. स्कूल बदली कोई बात नहीं, हम भी हमारे टाइम में भी ऐसे होता था. और आर दे गिविंग हर द एड एंड टॉपिक शी नीड्स. Okay, very, very important. And supported and understood. Very, very important. Education and social anxiety. We are one of the most important jobs you will have as a therapist is to psycho-educate the family, anybody's family. Okay, so there's a lot of times you will find that the person comes alone, adolescent तो अकेला नहीं आएगा, कॉलेज के बच्चे अकेले आते हैं. Sometimes one of the underlying things you will find is no, I don't want to involve my parents. Right. लेकिन जहाँ फैमिली आती है, एनी एज ग्रुप आई एम टॉकिंग अबाउट, सबको एजुकेशन विल बी वेरी इंपॉर्टेंट ऑन योर बिहाफ. एंड यू ऑल्सो हैव टू एजुकेट देम फॉर सोशल एंजाइटी. Okay, how can you educate her about social anxiety, that what she's facing is very clear. Okay, and the family as a whole needs to acknowledge that, support her through the process. She needs support. Okay, and that support needs to be given. The first assignment is family. So for the father, he needs to take the time to talk to his daughter, take her out, take the family out, have the mother to start talking. The mother is very protective. Is she open to communication? Also encouraging autonomy. We came to the mother part. She is very protective. Okay, sometimes mothers who are overprotective, the kids can be people who develop social anxiety. Not always, but I've seen that in a lot of cases. Because it is also important for the child, this one age 15, you'll have college students also, to have their autonomy, to have their independence. That is how we will develop as adults tomorrow. Okay, be very important. And also power her decisions. Let her take her decisions. If she's trying to do something, encourage her. Listen to her. Okay? Help her build her confidence. Take her to places. Let her enroll in places. I'm not going to pay for it. No. How can you say that? If your child needs support, lot of ways. Okay? So small steps that can be taken by the parents also to help the child seek autonomy and to regain a sense of self-control over life. Because again, everything that will happen with Riya will not happen in a day. टाइम लगेगा. द फैमिली नीड्स टू बी टोल्ड कि उसको ये मत बोलो कि एक दिन हो गया थेरेपी का कि नेक्स्ट डे शुड बी नॉर्मल. इट टेक्स टाइम. स्ट्रक्चर्ड फैमिली एक्टिविटीज. व्हाट डू वी मीन बाय स्ट्रक्चर्ड फैमिली एक्टिविटीज? हफ्ते में एक बार कैन यू सिट टुगेदर एंड प्ले बोर्ड गेम्स? कैन यू टेक अ ट्रिप आउटसाइड? महीने में एक बार कैन यू गो टुगेदर एज अ फैमिली समवेयर? कैन यू टेक वेकेशन? कैन यू सिट टुगेदर इन द डाइनिंग टेबल एंड ईट? Okay, so structured family activities. This is something we do every day. Okay, these are the activities because that will reinforce a sense of belonging. I can talk to my family. My family is interested in me. They're asking me about my day. They're asking me about my friends. Otherwise, it's going to be like my life, the life of the child, the college student, not people. Hence, structured family activities need to be encouraged. Anytime you have somebody who is from the adolescent age group, very important. Okay, so family therapy can also be encouraged in role modeling. Okay, I should have healthy role models because again, with adolescent, when it comes to social media, there is also something called eating disorders. Yeah, there is also then social anxiety, lot of things. So, who are your role models? What are the kind of role models that she needs to have? Good examples, healthy examples, so that she can develop her personality in that way. Okay, then she'll have the right kind of skill sets to deal with her social situations. Very important. Supportive environment. Again, a lot of time, if you have an adolescent, school bacha, or even college level kids, if they're coming to therapy, then of course, even their teachers can. You can actually write a letter saying she's under therapy, he's under therapy, whatever your client is, and please take care that these things are happening. And she feels safe, she feels welcome, so that the teacher will take more time to look after this. At least make sure that she's okay. She'll at least introduce a buddy system. Till the time Ria gets used to this environment, एक बच्चा है जो उसके साथ responsible है, will help her, assist her, okay, till she gets accommodated in the new environment. Okay. Next is a regular check-in. Yeah, establishing a routine of regular family check-ins can provide Ria with the opportunity to express her feelings and experiences. Check-ins very important so that can help the family stay in about her interactions. Yeah, and enables her to get the guidance and support she needs. So check-ins are very important. And lastly, and very important for her especially, and for you as a therapist. Okay, what are the techniques that can be used? Lot of techniques can be used. Of course, it depends on how you're training. If your orientation is CBT works well. REBT is there. There is DBT. There is ACT. There is psychoanalysis. There is expressive art. Lot of things. Okay, but especially when you're looking at social challenge, CBT can be there. Especially if very few things are there, REBT is again very effective because they're very well established. Okay, and again, CBT has lot of models like exposure therapy, gradually exposing Ria to social situations in a controlled and supportive manner. Very important so that confidence is gained over time. CBT. Okay, one thing. Social skills training, you can train her. This is something that's already taken into consideration. Again, mindfulness and relaxation. Yes, that is again beautiful technique. And for this induction technique, very beautifully works. Okay, again, breathing technique. For a person who's going through anxiety, body work is also very important. Meditation, relaxation techniques are also very important. Sometimes hypnotherapy also works beautifully. Okay, ACT, action oriented, again, is very much a mindfulness based technique. Okay, family therapy, again, involves the entire family. So family dynamics can be worked in. So there we are taking not only Ria into therapy, we are also taking the family into therapy. Okay, so there is a collaborative effort happening there, And because there is a collaborative effort, the family thrives. Because remember, the family has shifted. So on top of the fact that everybody shifted, everybody has some. How much are they able to? Is it difficult for them? Is the move difficult for them? So their family is going to be important. Again, and I emphasize group therapy. Group therapy is very, very important because especially younger children know having peer group makes them friends. In group therapy, same group, similar age group is not same. They'll meet new people. They have interaction and customs. And I'm not the only person going through this. सामने वाला भी उससे जा रहा है. That will give you some kind of sense, no? And again, that also will foster a kind of commitment. Social skills can be learned. Dialogues might be. So group therapy works beautifully. Narrative therapy. So Ria here seems to have made a certain narrative about her life. कि ऐसा ऐसा हुआ अब ऐसा हुआ. Okay? Has she personalized whatever has happened to her? एक narrative है, but narrative दूसरा भी तो हो सकता है. Okay? So narrative therapy is very important. She can then learn to externalize her struggles. Okay? So then a lot of ways can be used. So she can then remove the problem away from her personality. Okay? I have anxiety. No, I'm going through a certain phase of anxiety. View herself or view person there as okay, this is for people unexperienced. ठीक है वहां पे एक इंसान था वहां पे चार इंसान थे नेवर took the time to see कि they were open to me. Okay, did I ignore? वो भी important है. And support group. So again, support groups are not always, therapy groups. It can just be talking. Okay. For example, again, because this is very famous, you have Alcoholic Anonymous. It is for a particular purpose. So support वैसे हुए. तो locally, lot of communities में ऐसे होते हैं या होने चाहिए. Yes, can be enrolled because she might benefit from that. Social anxieties के भी groups होते हैं where people need to just talk. A lot of them are free. Okay, that will also provide for her a platform where she can learn from others. She can also have other social connections. And then the context will also be very supportive. ठीक है नहीं ये हुआ comfort, but other places I'm getting the comfort. So I don't have to isolate myself. So isolation की problem तो भी anxiety भी धीरे धीरे overcome होगा. They get to be a part of people who are there physically. She finds that okay, now I can get positive support there. Okay, then that is also a consideration. And again, remember, when you're taking therapy, when you're giving therapy, it is a multi-faceted therapeutic approach. So don't ever feel कि एक चीज अकेले चलेगी. And hence, in your kitty as a therapist, CBT एक के लिए चलेगी, दूसरे के लिए नहीं चलेगी. वहाँ पे you can use expressive arts. वहाँ पे you can use narrative therapy. वहाँ पे you can use DBT. वहाँ पे you can use psychoanalysis. So again, multiple modalities you can sort of look into. तो वहाँ पे इसीलिए your job as a person is very important, as a therapist is very important. You inform yourself कि client अलग तरीके के होते हैं. Yeah. And now you have to deal with every client differently. So CBT आपके पास है. You're seeing it is not working. It is time to switch. Okay, you find okay, this is a person art therapy को respond कर रहा है. Responding to this approach. Try that. Responding, okay, may not be very receptive to division therapy, but doing exceptionally well in group therapy. Okay? Has gone to a support group, is doing amazingly well. Okay? then this is going to be very, very important. And hence it needs to be taken into consideration. So inform yourself of a lot of modalities. It will help you when you sit in the chair of a therapist to take clients like Ria. Okay, and help her, support her, because honestly, it is very important for us to be therapists is to be informed about what is happening, especially in the society. So please make sure you wear the hat of the social psychologist, no matter what work you're doing. You're dealing with patients with anxiety, depression, couples, group therapy, anything. Very important. All right. So with this, we finish today's class on social psychology, and I'm sure you'll be able to take something out of it. Of course, a lot of this material will be available to you. Read through it. You may have your own perspective because as therapists, we may have our own. The slides will be provided, and also there's going to be a small homework for you to complete. It's very easy. You'll be able to complete it in time. All right. And thank you so much for being here, and thank you for every one of you who's been so patient as listeners. Yes, thank you so much. Yeah, and I've enjoyed being with you, and I hope and I wish you the best of luck as future therapists. Yeah, Madhura?
Ma'am, I would like to share something for 2 minutes if you allow.
Yes, please. Go ahead.
Uh,
Thank you so
Talking
much.
about social influence, it's a personal experience for all psychology students because we have peer study groups, mainly field visits, how our friends influence us, and also social media trends talking about Instagram. Some pages
Yeah,
are there like psychology facts where we study a lot, but there anything they have written anything regardless of the theories or logic. And also relationships with professors also are very crucial in that phase. And for example, for searching research topics also, we face a lot of anxiety like what topic to choose. And here cultural influences
yeah,
also come, and lifestyle choices also matter, study habits also, but still we are given the title like pagalonka doctor. So I feel
yeah,
every psychology student faces such kind of social influence.
yeah. See, again, we as a society have yet to reach a point where we will be given up due. And yes, it is very normal for us to be called this way. But again, one thing that I want to tell you that you may follow a lot of pages. A lot of pages you follow. You're trying to learn facts on social media. Please stop doing that. Okay? Please make sure you're referring to books. Please make sure you're attending classes from experts who have the subject knowledge. So I will tell you, much karo. Okay? Don't study from Instagram because not every person has the right kind of knowledge. So find those people. And of course, it's psychoeducation. Us as psychologists also have a big duty to educate people around us. Okay, it's only then that we will be able to create a society in the future where our field is given a lot of prominence. And we have to understand even our prime minister has now spoken about that mental health is important. To have a health act, mental health act that is being passed. It is being changed. A lot of regulatory bodies are coming up. Okay, so again, change will take time, but please, this is why again, social psychology, refer to books. If you want to research, if you want to find topics around research, read research papers. That is the best way to find. Don't go looking for socially. Don't look at ये क्या कर रहा है वो क्या कर रहा है. Find your own way to develop as a therapist. No one stand. See, this is a therapist. You can be your own genre. You can be your own niche of a therapist. Find your way back. And again, which is why offline is also very important. So Instagram may not always have the right information. Of course, I'm saying not always because there's some people who are very good, who are doing a great job. So who you're following, you need to take into consideration their background. I hope I answer your question, Madhura.
Yes, ma'am, thank you.
Thank you, Madhura. All right then, thank you so much for being here. Unless anybody has a question, we can see each other again for one of the other sessions. Okay? See you. Good night.